Hi,
Hi, Vanessa. Mary Mahoney here. How are you?
I'm good. How are you?
Great. Okay, so I'm Mary Mahoney, and I did my undergraduate at the U of M. I was an occupational therapist for a few years. I went back to school, to medical school there, did my residency there in OBGYN, was in private practice for a year, and then got kind of recruited en masse with a couple of my colleagues to basically be the general OBGYN division at the U of M.
Okay.
So the path to medicine, oh, is a challenging one. Um, for me personally, I had always wanted to be a physician, like all my life. And I am now what you term a first generation college student. So neither of my parents graduated from college. So I did have an older brother who had a PhD, but he tried to get into medical school and didn't. So he went and worked in a lab for a year and fell in love with the lab. And he's been very happy being a biology professor and doing lots of research. But I had kind of always wanted to be a doc, and I went to the U from a small Catholic, well, not small, but a Catholic high school here in the Twin Cities. And that freshman year transition can be challenging. I do sit on the admissions committee now, and I will say that we cut people slack about that freshman year, or particularly the first quarter. But so there I was at the U, and I didn't do very well in my first quarter, so I panicked. I thought, I can't do this. I can't be a doctor. I'm going to be an English teacher, and I found my way to occupational therapy. So my advice there is don't give up, get a tutor, do whatever you have to do to get yourself through. And if you really want to do it, you have to show that you want to do it. So that's with kind of your whole package. It's not just your GPA and the classes you took, but it's like your whole thing. For some people, you look at their application and it's clear they're into women's health and feminism, and they worked at a crisis center, and then they volunteered at Planned Parenthood, and they were a women's studies minor, and it kind of is a whole gestalt. Other people are into social justice, and you can see that in the volunteer work they've done or the paid work they've done. In addition to being bright. So sadly, lots of people want to become physicians more than we have the spots to train. Um, and it's a lot of time intensity to train a medical student. Once you get into medical school, it's 4 years. The traditional method is kind of basically 2 years in the classroom and then 2 years of clinicals. And then after medical school, you pretty much have to do a residency. So in the olden days, people were general practitioners, but these days, you got to do a residency. So if you want to be the kind of Jack or Jill of all trades, then people choose family medicines. They see children and adults, they do obstetrics. People want to specialize in adults, they do internal medicine, specialize in peds, they do pediatrics, or med peds together. If you want to do just OBGYN, you do that, all different choices. But yeah.
So what kind of drew you to OB/GYN? Why did you have a passion for women's health?
Yeah. So it's interesting because looking back on my life, I'm sure anyone who knew me could have said, oh, she's going to be an OBGYN. Like feminism was kind of my religion. I've always been very pro choice. And in the second year of med school, I was sitting in a Med Students for Choice lecture. They showed a video called When Abortion Was Illegal. And it was just women telling their stories of really scary situations of having clandestine abortions, sometimes with actual physicians, sometimes with not physicians, sometimes they were actually maltreated. In other ways, it was just so secretive that it was scary. And I thought, oh my God, that's ridiculous. And if I ever have the skill set to help women, obviously I have to do that. Like I just felt morally compelled that I have to do that because I believe so strongly in it. But
Mhm.
in medical school, I kept my mind open. I thought about psychiatry, family medicine. And then I did general surgery as my first rotation and fell in love with the OR. Just, oh my gosh, I love to be in the OR. And a lot of people, once they made it through med school and they're in those third and fourth year rotations, they either decide, yeah, I like to be in the operating room, so I'm going to pick a surgical specialty, general surgery, neurosurgery, urology. I mean, I'm not listing them all, ENT, OBGYN, um, there's a bunch. Or, no, 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 I don't want to be poking around people's bodies. I like to think, a differential diagnosis. I want to problem solve. I'm going to be internal medicine or pediatrics, and then all those subspecialties under that. So
Okay.
it's not just medical school. So you do medical school, and then there's a whole other chunk. So
Mm.
that's the other piece, that it's a long process, right?
Right.
And not many people go right 4 years of undergrad to 4 years of medical school. Usually there's a gap year in there, there's a
Mhm.
reapplication, there's, you know, filling out your application to apply, hoping you won't have to reapply. But if you apply and don't get in, it does not mean you could not succeed as a physician. So
Mhm.
don't think that. You didn't get in does not mean you can't do it and you wouldn't be a good doctor. It means there are an amazing number of people who want to do this and they have wonderful things to offer, and maybe next year.
Mhm. So how many years did you do occupational therapy before you reapplied to or applied for the first time to med school?
Yeah, so I was an occupational therapist for 3 years,
Okay.
and I worked with children in a rural setting. And people joked because I worked with kids who had CP. Some of them were birth
Mhm.
injuries. I actually worked with a child who had a spinal cord injury from a forceps delivery. So when I was leaving to go to medical school, people said, "Oh, you're never going to be an OBGYN. That's ridiculous. Oh, those OBs." And yeah, well, here I am.
Okay, so then, like throughout medical school, did you
Mhm.
in undergrad, did you do any like research or like what was your involvement like or
Yeah, I probably wouldn't get into medical school now. Like I don't have that great resume. I think what got me in was I was an occupational therapist. I
right.
had already a medical type degree and I'd worked in it, I had some level of professionalism.
Mhm.
And in my medical school class, there was a guy named Dave Hell. It's not a ridiculous name, Dr. Hell. And he was a nurse. He'd been an ER nurse for a handful of years and then applied to med school. um, Certainly people do research. There are those people who love bench research and get a publication in or spend a lot of time in the lab and really dive into physiology. That's great. There's some people who are really service driven, and you can see that in their application. They're all about social justice and feeding the homeless and solving all the problems in our society. um, yeah, so people come through it two different ways. A lot of people do the scribing thing, so you're learning about medicine. People do some shadowing. You don't need a ton of shadowing. When I see, several hundred hours of shadowing, I'm thinking, well, you want to do something else besides stand in a room and watch, like do something. But we like shadowing. You can't just apply to medical school and not know anything. Well, I saw a doctor a few times as a kid, and now I want to be one. You have to have more understanding of the profession. Because
Okay.
what we don't want is people to get in medical school and one can't make it academically, which rarely happens because everybody's so bright and we have so much support, or two get in and think, yeah, I don't want to do this. This isn't for me. I can't handle the stress. You got to be kidding me. This is at least 7 years of my life. No, I want to have a family, or I want to have a life, or that sort of thing.
Mhm. Right. Okay, and then moving into like your life as a physician now, what does I guess a normal day look like for you between like the OR or like inpatient and outpatient? How do you kind of split your time?
Yeah. So let me tell you what a typical OB would do first. So most physicians are not academic physicians. They work in private practice. Their patients come see them, they help them. That's what they do. As a teaching physician, I always have a medical student or a resident with me. There's more kind of committee work. I sit on the medical school admissions committee. There's other stuff you do related to teaching in the medical school. And some people do a lot of research, which I do not. So we have a different amount of patient contact. A typical OBGYN, a full-time OBGYN doctor here in the Twin Cities, would work 3 or 4 days a week, have one day off, either a set day or maybe their post-call day, be on call like one night a week and like maybe one weekend a month. And groups work it out differently. If you're in a huge group, like 30 OBGYNs, maybe you only have a weekend shift every other month because there's so many doctors. But if you're in a smaller group, you're on call a lot. So, for example, my particular life, I was on call last night. So this past weekend, I went hiking on the Spear hiking trail, and we're trying to get out, and I injured my ankle. I'm like, oh my god, we got to get going. And the whole way home, I got to get home. I'm on call. I call, double check. Am I in house at 6 o'clock? Yeah, you got to be in here. You're the emergency doctor on call at 6 o'clock. And it didn't even cross my mind that I wouldn't work. I sprained my ankle. So what? You can stand to a C-section. Like it's not for the faint of heart. You know what I mean?
Mhm.
You have to have common sense and take care of yourself, but you can't be the person who, oh, I have a little cold, I'm going to stay home. Some people just really, really tend themselves well. That doesn't really work well as a physician. You have to think of others first. Like, oh my God, they need me at the hospital. I have to be there. I'm going to wrap my ankle. I'm going to tell the nurses and the residents they know they got to call me early because it's going to take me longer to get there. I'm going to let people know what's going on so we're safe, but I'm not going to not work. Yeah. So that's one piece about being a physician. But so my life, so I was on call last night. I slept in the hospital, and then I've always had it so my day after call is off because when I haven't gotten enough sleep, I just cannot deeply care about other people's problems. You're sleep deprived. If you're hungry, you have to go to the bathroom, you're exhausted. You can't really be empathetic and caring. At least I can't. Maybe other people can, but I certainly can't. So I knew always I did not want to work post call. So I've worked part-time actually all my professional career. And I had children right when I graduated too, and I wanted to have time with my kids. Um, so I work like 1 day a week of clinic, 1 day a week on labor and delivery, a half day of operating, and then like another half day of abortion care. And most OBGYNs don't do abortions. It's a small handful of people, of family doctors and OBGYNs who do. That just happens to be my particular area of passion. So I do that a fair amount.
Wow.
But we can save that for a med students for choice lecture. I won't go on and on about that. But what I like about it is you're actually helping someone. So it's a procedural or medical, but you're like fixing a problem. So I love to fix things, like make it better.
So you'd say like the hands-on OR aspect of your career you prefer more than like just like the regular office visits and things like that?
I think for me, yeah, and not just in the operating room, but labor and delivery.
Right.
So I often get, I have a pair of maroon and gold pom poms that sit by my medical school graduation frame degree in my office that the midwives gave to me because they call me in the middle of the night because this woman's tired and, oh, Dr. Mahoney, do we need to do a vacuum? Well, the nurse is tired, the midwife's tired, the patient's exhausted. They're all just, I just come in there, yeah, you can do this, you can do this, and cheer loudly and scream, and usually she delivers. So I like supporting people, but kind of the emotional piece. When you're operating, people are usually asleep or at least heavily sedated. Except for an outpatient abortion care, they're not. So you're talking with them and engaging with them and getting them through it. So what I like to do is get people through hard things. And in something hard that's very meaningful to them. So the birth of their child, like the woman who delivered last night, her first child had died from SIDS, and here she is within a year having another baby, super excited to have a child in her arms again, and very nervous, understandably. She's lost a child. She was terrified. So all that extra time reassuring her, and always in the back of our mind, remembering this was a woman who lost a baby. Like, she can ask me 100 times, is it okay? And I will say, yes, it's okay, because that's what she needs. So there's that emotional piece that I like about OBGYN. So again, I'm selling OBGYN. But of course, family doctors have that. I mean, oncologists, oh my goodness, when people have cancer, they love their oncologists. They do whatever they say, and there's a deep emotional connection. So that's the part of medicine I really like and thrive on. Other people, it's the intellectual challenge or
Yeah. You kind of talked about it already, like working part-time to balance your life between like work and your personal life, but are there any other things that you've kind of done to make sure there's a balance there and not get so sucked into your career?
Yeah, so you have to be really good at saying no. One of my colleagues once said to me, I've noticed you only do things you really want to do. I said, yeah, is that a problem? And she's like, no, like I've just noticed that. So if I kind of don't want to do something, I don't say I will just because someone has to. No, I'm not going to do it. So, I agreed my day off. I'm going to have a conversation with you because I know when you want to go to medical school, you want to hear about it. And so I'm willing to give you, half hour of my time because I care about it enough. But if I didn't really want to do it, I shouldn't do it because I would do a crappy job. And so, like, I don't do research. I don't like research. I don't understand it. I'm not great at it. That's not my thing. I'm not doing it. And by setting that boundary, then I've been happier in my job. I mean, I dabbled in research a little when we got all this pressure to do it. And it was terrible. It never got published. I did really good research because I buddied up with a psychologist who'd published, but we could never get our stuff published. It was very frustrating. I'm like, what a waste of time. It seemed very inefficient to me.
All right. And then I guess kind of just as like one of the last questions I wrote down was just advice for undergraduate students. You kind of gave some already, but just I guess what would you tell your younger self when you were still in college?
That even though I took a detour, that was okay. And that's probably why I got into med school. If I'd just gone straight through, I don't know if I would have gotten in. My detour is probably how I got in. I was older. I'd already owned a home. I was married. I had a professional allied health career. So I was bringing that to the table, that experience of working with families, working with kids with disabilities. That was like a little subset of knowledge I had that helped me get in. And I think you want to really think what it is you want to get out of your life and your career. So I'm going to be frank here. If you want to make a lot of money, you should go into business. You should not go into medicine. You know, if you want to feel like you're really helping people and you can put other people first, there's a lot of ways to do that. There's nursing, there's social work, there's being a physician. Um, if you like the intellectual challenge and you want to understand why things are, then be a doc. If you're like, I just want to help people and see people, maybe you want to be a PA, maybe you want to be a nurse practitioner. You know, is that the appealing part to you? Or do you need to understand why you're doing what you're doing?
Mhm.
And then also a little more procedural. Um, PAs and NPs do some, but in general, they're not the main surgeon ever. They might
Mhm.
assist or something, but
Right.
and then also I think that really understanding why you want to do what you want to do. And it can be hard to do that, and you want to make sure it happens to people whose parents are physicians and they're smart. And so, okay, I guess I'll be a doctor. I don't know, I'm going to be an engineer or doctor. For my husband, for example, in his undergrad, he was a really smart guy. So they put him in the engineering program. He had no interest in being an engineer, so he dropped out of college. Then we got married, we're hanging out. I was in med school, and when I was in medical school, I loved it so much I talked him into it. Like, it's so cool, it's so fun, you should do this. And so anyways, I was a little too enthusiastic. So he went. But so think about what it is you're trying to get out of your career. And then also, I think now, in terms of that family work balance, there is a lot more of that, and certain specialties lend themselves to that. For example, ER, that's very much shift work. You know, when you're done with your shift, you're done. I mean, if you have a leadership role, you might have meetings and whatnot, but ER doctors who are just seeing patients, when they're done, they're done. And it's easy to work part-time. You know, you don't find any part-time neurosurgeons. No, I have never even heard of that. I remember being on a women in medicine panel at the medical school. So it was about 5 physicians who were female. And there were 2 women who were educators and had significant research careers. One was a neurosurgeon, one was ER doc. Neither of them had children. It's like, I mean, you cannot have this huge career and have children that you parent a lot. I mean, you could have a nanny or a stay-at-home partner or whatever, but I don't think you're going to have, I certainly couldn't have the relationship I wanted with my children and have a career like that. So, but you can certainly be a physician and be, have a really rewarding life experience without doing all that. And you don't have to cure cancer, right? You can just take care of people with cancer. And there are those physicians who are wonderful and they, you know, are working on curing cancer. And some of them have families too, and they find a way to make it work. They outsource a lot of things, I think.
Right. With the medical school applications, you mentioned that you're involved in that. What are some of like the strongest applications you see, or if you do the interviews, or what makes a strong interview, or what separates like someone you would accept versus someone you would kind of
Yeah.
look over?
So there isn't really one answer, and I can, of course, only speak in generalities. So general advice I would give: be yourself. If you have trouble interacting or whatever, figure it out. Do Toastmasters, see a therapist, do 100 mock interviews. I don't know, whatever it is you need to do, you got to do it. So interviewing obviously advantages people who are extroverted, which is unfair, but it does. And most medical schools have interviews. One thing to know is a state medical school, like the University of Minnesota, is funded by state dollars. So at any medical school, you can look at their statistics and you see how many people are from that state, right? So Harvard, they just take the best. They don't care if they're from Massachusetts or not. They're just going to take the best. U of M, we have an obligation to the people of Minnesota who paid taxes to pay for our medical school to pick people who are likely to practice medicine in Minnesota. Now, not everyone's from Minnesota. You know, we like to have a nice balance. And we don't have an exact number, but in our minds, there's this sense. So paying attention to where you're a resident when you apply. Where are you a resident when you apply to medical school? Because that's your home institution. So some people do that for college. They go live in Colorado for a few years as a ski bump and then apply to college as an in-state, right? I mean, you kind of play the game. Everybody plays the game a little bit. Yeah. So be yourself, figure out a way to do a good interview, pay attention to where you're living, apply to several places. If you don't get in, reevaluate. Is this something I really want to do, or do I have a plan B? If it's what I really want to do, I'm going to try again.
Mhm.
I remember when I applied only to Minnesota schools. And my plan was the next year I was going to fly all over the country. And then the third year I was going to fly international. Like I'll go to the Caribbean and go to medical school there, I mean, like I really wanted it. Once I decided I'm going to do it, I had a plan.
Mhm.
And some people after that first year, maybe they go and work in a lab like my brother and fall in love with that. And it's great. And then they find their way to the right place anyway. Um, have people proof your application, don't have typos, don't be sloppy, think about your writing. People have to read through a bunch of these. So it's kind of like that common app essay. I mean, it's important to pay attention to it. And then I said, and this is just my personal opinion, people who have hundreds of hours of shadowing, it's like, well, I don't think you need that. You need to show us you know what a physician is. We like to see people who have a charitable side to themselves. Like, what have you done that demonstrates you care about other people?
Mhm.
You know, like it's healthcare. You're supposed to care about people. So how do you demonstrate that to us? And people get picked for a variety of reasons. There could be a total introvert nerd who has a PhD and has published a bunch in some specific area, and then they want to be a physician scientist, and they get in too. So it's yeah. So figure out what your strong suit is and capitalize on it.
And then I guess just to kind of conclude, thinking about the future, do you foresee like nurse practitioners and physician assistants having a bigger role in healthcare? Because it's always traditionally been more so doctors, but
Yeah.
I don't know
So
what you experience where you work.
mhm. I work with nurse practitioners and nurse midwives, and I love that. It's great. And I think every area of medicine, there's a role for that type of provider.
Mhm.
Um, and our midwives have an independent practice, like, um, we're not like supervising them. I don't have to sign off on their work. They're fully competent and they know what they're doing. We have a very collaborative interaction. We consult back and forth about things. They feel comfortable with us, and so when their patient needs an operative delivery or a C-section, they say, "Oh, Dr. Mahoney's on. She's fine. She's gonna take good care of you." So there's this nice back and forth. Certainly, PAs. There's some PAs at the U who are amazing that I work with, like in HEMONC. Oh yeah, I mean, and in the ICU, there are some people who are just awesome. So physicians should not be afraid of people who are nurse practitioners and PAs. They help you. Their scope is limited, and they can help you do some of those things. And if you have a nice back and forth relationship, it's not anything to be afraid of.
Mhm.
Yeah, I think it's great. There's a physician shortage, so it's a good way to provide care to enough people by not making the process so long for everybody. I was thinking about it as I was driving home for this about what um, advice I have, and that would be I would go to medical school again. I absolutely would. I have a daughter who just started at U Chicago. Her first day of classes is tomorrow, and undergraduate degree in philosophy, bioethics, and then applying to med school. And I encourage her to do it. Um, and it's interesting because my husband practiced for a few years and quit, so it's not for everyone. Um, but I find it very rewarding. I think you have to have some good self care to figure out how to get what you need so that you can give to other people. So I have a strong friendship circle. I'm an extrovert. I need a lot of that time. And particularly now with COVID, I have figured out, oh my gosh, if I am outside, I am happier. I have got to be in nature. And I didn't know I love nature. Like, I mean, I like plants, whatever, but I don't think of myself as, oh yeah, the nature person. But I just noticed, oh, a day when you don't have a walk and a day when you walked outside for an hour, you're a heck of a lot happier when you've been outside.
Mhm.
So you have to have the mental fortitude to be a physician. You know what I mean?
Mhm.
Um, and having said that, I mean, I cry at work sometimes. Like, if a patient's really mean to me, that makes me cry sometimes. And, my colleagues support me. Or there are hard things, don't get me wrong. In medical school, I remember in third and fourth year rotations, I never cried from a attending yell at me. It was two nurses, an ICU nurse and an OR nurse, who were just mean. They made me cry. So there are definitely hard things about what we do, and I think you have to be able to deal with that so that you can fill up your tank enough to really show up for your patients.
Right.
um, yeah, how to take care of yourself enough. And it's horrible. I mean, it's a high stress job, let me be clear about that.
Mhm.
We've had medical students who've committed suicide in recent years, and it's a horrible thing. We don't want that to happen.
Mhm.
um, yeah. And so I think you just have to make sure you're in a place with the right support, to be able to do the work.